Hey everyone, and welcome to this explainer. Let's just dive right in because we've got a really fascinating and honestly highly debated topic on our hands today. We're looking at a monumental shift in Uganda's healthcare system. Specifically, we're talking about some sweeping changes to the country's medical internship program that are slated to hit in August 2026. The shift? It's already causing massive ripples across both the medical community and the government. So we're going to break down exactly what is happening, why it's happening, and what it actually means for the future of healthcare. So here's a question for you. Who should pay to train a doctor? Sounds like a pretty simple question, right? But this is exactly the core conflict we're unpacking today. Is the final, absolutely grueling year of hands-on clinical training a public service that the government has a duty to fund? Or is it just an extension of a student's academic journey that they should finance privately? Keep that question in the back of your mind as we go through this explainer, because how you answer it kind of fundamentally changes how you view this whole situation. All right, Section 1, the new internship policy. Let's look at the exact shift the cabinet has approved for August 2026. Okay, so there is a really stark contrast between how things work right now and how they're going to work very soon. Under the current setup, medical interns actually receive a net monthly allowance from the government. It ranges from about 1 million to 2.5 million Ugandan shillings. But under this new policy rolling out in August 2026, this mandatory internship gets folded directly into a 6-year university degree. And the result? That clinical training basically becomes an unpaid, completely self-funded requirement that these students have to complete before they can even graduate. Let's break down the actual mechanics of this 2026 policy a little bit more. If a student has been privately sponsored through medical school, well, they must continue to fully fund themselves during this really intensive internship year. Now, if a student was government-sponsored, they still aren't getting a cash allowance. Instead, they might get some in-kind support, things like meals and accommodation, but that's only if the hospital itself can actually provide it. And the biggest structural change here? Universities will literally withhold a student's graduation and full licensing until this unpaid internship period is successfully completed. No way around it. Moving on to Section 2, government financial constraints. So why the sudden and dramatic change? The main driver, at least according to the government, is just a sheer lack of funds. And this is being exacerbated by a really rapid growth in the number of medical interns graduating every single year. The system is just overwhelmed. Listen to this quote from President Yoweri Museveni. He says, "Some people are saying that the government must pay, but I think that's risky because the government would pay, but it doesn't have enough money since it has got a lot of things to do like roads, security, etc." So that's the official stance. National budget deficits and competing priorities mean they simply have to cut these allowances. Now, the Ministry of Health does have a specific plan for the money they'll save by scrapping these allowances. They plan to redirect it toward training medical specialists. Uganda currently faces a really critical shortage of specialists. We're talking cardiologists, specialized surgeons, and the government's argument is that moving these funds is absolutely necessary to bolster those advanced training programs and just improve overall national health outcomes. Which brings us to Section 3, a severe doctor shortage. Let's look at the reality on the ground. 1 to 25,000. I want that to sink in for a second. This is Uganda's current severe doctor-to-patient ratio. 1 doctor for every 25,000 people. It's a staggering figure, and it really highlights the incredible day-to-day strain on the country's entire healthcare system. And to put that into perspective, just look at how far behind Uganda is compared to its peers. The World Health Organization's recommended guideline, that's 1 doctor for every 1,000 patients. Neighboring Kenya sits at about 1 to 10,000. Tanzania is at 1 to 12,000. So Uganda's 1 to 25,000 ratio, that is a massive, massive healthcare deficit. Because of this severe shortage, these medical interns, they are absolutely vital. They aren't just students quietly observing in the background taking notes. Right now, these interns shoulder roughly 75% of the daily operations across 74 government hospitals. They are working grueling, insanely demanding shifts that last anywhere from 36 to 48 hours, covering emergencies, overnight duties, the whole 9 yards. They are quite literally the frontline workforce keeping a struggling system afloat. Section 4, budget priorities and contrasts. This is where critics are pointing to other areas of the national budget to make a highly visual counterargument. 300 billion Ugandan shillings. Critics are quick to point out that this is the massive food and entertainment budget allocated for Parliament alone. They highlight this huge figure as a really glaring contrast to the "we don't have enough money" claim that's being used to justify cutting intern pay. And the contrasts continue. 315 million Ugandan shillings. This is the individual car allowance that is allocated for each and every one of the 556 incoming lawmakers and the next parliament. So the crucial point for the critics really relies on this exact juxtaposition. They are placing unpaid intern doctors, the ones handling 75% of hospital operations on those crazy 48-hour shifts, right next to lawmakers who are receiving massive food, entertainment, and vehicle allowances. Their primary argument here is that the issue isn't an actual lack of national funds, but rather a lack of prioritization for healthcare workers. Section 5. Pushback from medical professionals. So, how is the medical community actively responding to this 2026 policy? Well, the reaction online has been incredibly swift. On social media, Dr. Mirambe Joel writes, "It's dangerous for junior doctors to work without pay for a full year. How will they feed, pay rent, take care of expenses?" And this really humanizes the fear that these young professionals are feeling. They're asking incredibly practical questions. How can they possibly survive, let alone provide safe medical care, with absolutely zero income for their basic living costs? And this resistance isn't just online, it's highly organized. Dr. Frank Asingwe, the president of the Uganda Medical Association, states, "The policy subjects medical graduates to an additional year of intensive clinical work while removing the facilitation that has traditionally enabled them to meet basic living costs." The UMA represents doctors nationwide, and they are formally rejecting these proposed changes. To build their argument, the UMA points to a really glaring disparity when you compare Uganda to other African nations. While Uganda is proposing to pay its interns 0 shillings, interns in Kenya receive the equivalent of 5.5 million Ugandan shillings, and in South Africa, it's nearly 12 million shillings. The UMA argues this massive gap is going to severely impact the morale and the long-term retention of Ugandan doctors. So to summarize, the Uganda Medical Association lays out a few core arguments. First, they argue the policy wrongly conflates academic university training with professional licensure. Second, it drastically increases the financial burden on the students themselves. Third, and perhaps the most concerning point, they warn it's going to exclude economically disadvantaged students, essentially turning medicine into a path that only the wealthy can afford. Ultimately, they're arguing that it shifts a public health system's cost directly onto the shoulders of private families. Which brings us to the end of our explainer today, leaving us with one profound, really lingering question. What does all of this mean for the future of medicine in Uganda? I mean, with a ratio of 1 doctor to 25,000 patients and a looming policy that requires an unpaid year of 40-plus hour shifts, how is the nation going to attract, train, and actually retain the medical workforce it so desperately needs? It's a hugely complex situation, and the stakes are incredibly high on all sides. Thank you so much for joining me to explore this critical issue today. Stay curious and keep learning.